shutting down abortion killing centers. Today on The Simple Truth, we consecrate everything to the Sacred Heart of Jesus through the Immaculate Heart of Mary and the pure, strong, chaste heart of St. Joseph. I'm your host, Jim Havens, and our guest today is Missy Martinez-Stone, President and CEO for the Center of Client Safety. Centerforclientsafety.org is where you can find all the good work being done there. And the Center for Client Safety investigates, reports, and shuts down abortion businesses to protect vulnerable women and children from harm. Missy Martinez-Stone, welcome to The Simple Truth. How are you today?
I'm so good. I'm so happy to be here and just excited to tell more people about the amazing work of the Center for Client Safety.
Awesome. Yeah, great blessing to have you with us. And first, can you share a bit of your background with us and the story on how your organization came to be?
Yeah, absolutely. So I grew up in the Deep South. I didn't even know what abortion was. It was not something that was talked about. I was raised in the evangelical church, and unfortunately in the 90s, that again was not something that was talked about. And in high school, my family moved to the Northern Virginia area. And thankfully, because of our proximity to DC, we actually had a number of pro-life leaders who went to our church. And it was very ingrained in our culture that we were against abortion. And they started taking our youth group to, pro-life events. And we go to the March for Life every year. And I just had this moment when I was probably 14 or 15, walking down Constitution Avenue, surrounded by hundreds of thousands of people, and just realizing that this was abortion really mattered. The injustice of abortion really mattered to God. And I thought, it's probably going to really matter to me too, and set me on this path. I graduated early, 2020s or early, let's say 2012, I graduated from college and went back to DC and started at Students for Life of America full time. And that's when they were small. So if you can imagine a time when Students for Life wasn't an absolute force in the pro-life movement, this was way back when, and have been working in the movement for almost 15 years now. And, those connections led me to really discerning about what is my contribution, what do my gifts bring to the table, and how can I end abortion in my way. And I just realized I'm not an activist. I'm not, we were going on college campuses and I could do it, but I could tell I wasn't in my gift. And I was approached by David B. Wright, the founder of 40 Days for Life, with this idea of an organization that bridged the gap between the laws that were on the books and the actual enforcement of them. And he starts describing what the job would look like, or what this idea would entail. And it's everything that I love. It's all the things that I had said, I really want to do research and processes and administration and really be in the background. Strategic thinking. And so he's describing this really cool idea. At the time, we didn't even have a name for it. We called it Women's Health Protection Project. This was early 2018, I think. And it all just kind of blossomed from there.
Mm-hmm. All right. Yeah. And so then as you get going in this, I guess, what were the steps forward to become what you guys are up to, what you're doing today?
Yeah. So the original idea, there was a number of pro-life leaders that had gathered and had identified that the pro-life movement, while it was very successful in a number of ways. And at that time, everyone was trying to pass legislation. Everybody wanted to be the case that got before the Supreme Court that overturned Roe. So there was a lot of legislation going out. But when you talk to the people on the ground, like the sidewalk advocates or the pregnancy centers that were serving the women and the families that actually were interacting with these abortion facilities, regardless of if it was a very conservative red state or a blue state, it didn't matter because the rules weren't being enforced. And so essentially you had all these rules on the books, but little to no enforcement because these agencies didn't want to touch abortion. And unfortunately, that the people who pay the price for that were the women themselves and the children going into these essentially unregulated facilities. And they said, how can we bridge this gap? And so they started having discussions about what is the best way to find out what's going on, get it into the right hands, but do it in a way that is effective, that is strategic, that protects everyone involved, specifically the women. And that's what I was handed. And they said, can you figure this out? And I went, I guess so. And so we really just started talking to the people on the ground, the pregnancy center people, the SAWC advocates, going, what are you seeing? Okay, what are the kind of laws that are not being enforced? Why are they not being enforced? What are these agencies doing? And we really, from there, built the strategy to meet that need. And so over the past 5 years, we've really looked at, what laws are on the books, how are they being enforced or not enforced? So who sees them? So the SAWC advocates and the pregnancy centers, they know what's going on. They see that stuff. How can they get that information to us in a way that we can turn it in? How can we get that information to the agencies in a way that they don't just turn it down immediately? And as a startup, I mean, you have to remember, nobody is doing this. Like at the time, enforcement just looked like exposure. Like that was like the knee-jerk reaction, I think, of a lot of the movement, was when you find out something nefarious that's going on at the abortion facility, you tell the media because it's so crazy that people are going to be upset, which logically that makes sense. But when it's abortion, people lose their ability to be reasonable. And so what you would expect people to react from these horrific situations, it just doesn't, you just don't get the same response. And so we had to really look at that and go, is there a better way? And so over the last 5 years, all we've done is really look at how can we take the rules on the books? How can we ensure they're enforced? How can we hold them accountable and do it in a way that protects the people involved, protects these relationships, empowers the community advocates. And when you're in a startup like we were building the plane while we were flying it, it required a lot of flexibility and reworking and that trial and error. But over the past 5 years, I feel like now we've really honed this strategy of when you find out an abortion facility is doing something, here are the steps that you take. Here's how we assist. And we're now, considered experts in this field in the movement. We're considered national experts on how to shut down an abortion facility. And it's been really cool. I am proud of our team and what we've done, but we really couldn't have done it if we didn't have all of those people giving us this information and helping us, figure out what is the most effective, most strategic, and most impactful way forward.
Mm-hmm. Yeah, we're talking with Missy Martinez-Stone, President and CEO of Center for Client Safety, centerforclientsafety.org. What kind of cases are you looking for? When should someone contact you for help?
You would think that we are enforcing quote unquote pro-life laws, but most of our cases actually deal with basic general medical negligence. We very rarely are dealing with code just about abortion. The people that work in this industry are typically, at one point, every case that we had involved a physician with a criminal background. These are not top of the line, top of your class medical providers. They typically have some kind of sordid past, and in general practice very sloppily. So they typically have dirty facilities. They don't have the proper licenses. They're using people to do things that they are not licensed to do. A lot of patient privacy, really anything that is just bad medicine can be brought to us. And we are very careful about, specifically when we're working with the pregnancy centers or any medical practitioners, like, please don't violate HIPAA. Like, we can't take anything from people who, hear of situations in those settings. But if you're a volunteer and you come across information that seems negligent or seems bad, it probably is. And so we have a website on a form on our website. It says report. You can go straight to that and fill that in. But it's really anything where the woman didn't feel did he get properly consented? Things were, oh gosh, we've gotten so many different, you name it, we've probably seen it. But really, the practice is if you see something, say something, and if it's bad, it probably is a violation. And so we'd rather everybody just tell us what they can, and then we can decide if a case can be opened.
Mm-hmm. Yeah. And how many, I guess, situations have you had where you have been part of shutting down an abortion killing center?
Yeah. So our first permanent closure took us about a little over a year. And that sounds long. That's actually very short. We were surprised. Like, oh my gosh, it only took a year. Most of our cases, we have a case that's going on 4 years right now. These are long. We play the long game. But we've permanently shut down 2 abortion facilities. We forced an abortionist into retirement. We had another abortionist banned from doing abortions ever again, and his license was suspended. We've stopped Planned Parenthood from opening. I mean, I can go on and on, but we have a track record now that shows that our strategy works.
Mm-hmm. Yeah, we're going to get into a bunch more here today with Missy Martinez-Stone, Center for Client Safety.org. And what she was talking about a little bit earlier is something that they call the accountability gap. This is the need that Center for Client Safety is fulfilling, right? They're filling this need, the accountability gap, meaning laws only make a difference if they are enforced. So a very simple concept. So of course they need to be enforced, and someone needs to be advocating on behalf of enforcing them. So we're going to get into this. You know where I'm going if you follow this show. At some point, we're going to get into a discussion on the state of Florida, but we're going to get into a bunch more when we get back. Stay tuned.
iCatholic Mobile is a 5G wireless provider dedicated to supporting your faith and values, offering unlimited talk and text, reliable data, and plans that support Catholic causes. A portion of every dollar helps sustain the mission of the Station of the Cross Catholic Media Network. With nationwide coverage, iCatholic Mobile connects you to what matters most. More information is available at iCatholicMobile.com.
iCatholic Mobile underwrites for the Station of the Cross.
Welcome back to The Simple Truth. Jim Havens here with our guest today, Missy Martinez-Stone, President and CEO of the Center for Client Safety, Center for Client Safety.org. And Missy, I was interested when I was reading a lot on your website, but one thing that caught my attention was how the investigations that you all do. I guess I sort of just had the impression that you were probably a lawyer. I don't know. You give off sort of this lawyerly vibe, right? And so and that this had something to do with a bunch of lawyers figuring out this way how to shut down the abortion centers. But yeah, I found out that's not the case. You do work with lawyers at times, but I guess tell us how that works. You guys are basically filling a gap, saying you're here to step in the gap and do this research with an expertise that would be a very much more of an arduous process for someone to try to take on themselves. Plus, if everybody had to try to take it on and figure it out, that's very inefficient, and many people would stop and wouldn't continue on. So it does seem like you are definitely filling a very important need. But anything else you want to say on that?
Yeah, absolutely. You're asking the question probably that we get the most is, are you an attorney? And I'm not. I thought about going, but I didn't want to, go hundreds of thousands of dollars in debt. And, I didn't see the need for it. But what's interesting is you don't have to be an attorney to do the part that we do. And it's actually preferable if you're not. We're not doing medical malpractice. We're not suing anybody. We're not doing criminal cases. We're working at the state bureaucracy level. And so that's medical boards, health departments, any kind of licensing, waste management. And you don't have to be an attorney to do that. Now, we work with clients. We educate them on how to submit complaints, but we're not representing anybody. We're not submitting them on their behalf. We teach them how to do it. And what's great about this process is that it's a lot more accessible to the women who were victims of the abortionist. Court cases are expensive. They are public. You're asking a woman who just went through a pretty traumatic experience to sit and possibly be deposed. And a lot of the violations that we're dealing with don't even meet the standard of medical malpractice or civil litigation. But there's this whole other system that we can use that goes directly at the physician's licenses with the medical boards and the health departments. It's a lower standard to meet. It's free. The girls don't have to be involved other than signing a piece of paper. They don't have to testify. And we have found that the process is just a lot more accessible on every level. It's not as cumbersome as a lawsuit. And in a lot of these cases, especially with medical malpractice, they have insurance for that. They pay the medical malpractice lawsuit and then they go right back to work. Whereas the cases we're taking directly to the medical board, these medical boards can pull their medical license. The health department can pull the license of the facility. And so we've just found it to be much more accessible and also just an easier process and more effective because they actually have the authority to stop the abortionist, whereas in civil cases, especially, they're just paying the money. But a big part of that is we learned this system, because think about it. We're working in every state. Every state has how many licensing boards, has how many counties, has how many cities that all have their own codes. Like, we have to go through and figure out, okay, what in this place, what is their code? Okay, who is responsible for it? Okay, what is the protocol for submitting it? And do that, hundreds of times. We have learned the system, because what we found was we want the sidewalk advocates to be sidewalk advocates. We want them out there. Like, I would be a terrible sidewalk advocate, and I'm aware of that, and that is okay. But do you want me to dig through hundreds of pages of legal code to look for a single sentence? I'm your girl. I would love to do that. And it's all about knowing our strengths and putting ourselves where we will be most effective. So we want the sidewalk advocates doing sidewalk advocacy. You need to be focused. We want you to be the best sidewalk advocates that you can be. And when this comes up, you pass this off. We'll work with you. We'll take on the burden, figure out what happened, and partner with you to make sure it goes forward. But really, again, we're going back to that initial conversation of how do we make this effective and strategic and be really intentional. And it was, everybody do your thing and do it really well, but do it with linked arms. Do it together. And so sidewalk advocates, you need to be the best sidewalk advocates that you can be. Pregnancy centers, you need to be the best pregnancy centers. Policymakers, be the best policymakers. And when we all do that, and then we come in with this piece that kind of ties everything together, that's when we had success. That's when we shut down 2 facilities in Florida. That's when we stopped 2 Planned Parenthoods from opening in upstate New York. We've had entire school districts change their policy on staff taking students to get abortions. I mean, we've had so many successes now, and it's when everybody does their piece and does it really well. But we come in with this just extra little piece that bridges that gap and brings it all together and pushes it forward and helps shut the facility down.
Mm-hmm. Yeah, I love what you're talking about in the witness here, that really does speak to that need for all of us to be involved, but you have to discern, what are your gifts, abilities, talents, calling? Where is God calling you to be a part of this? We all need to be working for an end of this terrible evil of child murder, of abortion that is ongoing in our day. But there are different roles, different things for all of us to do. I know that one thing to even drive this point home, one of the scriptures that I think is so powerful to so many, it ought to be on this, is Matthew 25, the judgment of nations, and how Jesus says, he identifies himself with the least and says, whatever you do to the least or don't do, you do or do not, you do it or don't do it unto me, right? And right before that passage, and by the way, he ties that to our judgment, which is an interesting thing to ponder, but right before that passage, what do we get? We get the parable of the talents, right? So discern the talents, don't bury them, go forth, and then go and love our Lord in the least of these, and let's lock arms and do what we're called to do by God's grace. So great to see gaps are being filled by the Holy Spirit inspiring this good effort, Missy and the folks over there at Center for Client Safety. And I guess I want to ask on the practical level, if there are folks listening right now, and I'm sure that there are, either sidewalk advocates, counselors, or just concerned citizens. I'm sure we've got a bunch of those who maybe haven't discerned necessarily how to get involved, but maybe somebody just thinking, this sounds really interesting. Maybe there's a way I could just start by doing a little investigation of my own on the abortion killing center that is nearest to me. What would you recommend for someone if they just want to do some preliminary digging to try to find out, what's out there, if they could find anything that could be helpful in shutting them down?
Yeah, I love what we do because not only are we filling a need in the movement that no one has done before, but it's also attracting a lot of people who hadn't quite found their place, because a lot of the stuff that you see is very outwardly activist, marching and sidewalk, the sidewalk advocates and the pregnancy centers. It's all very, we'll say, extroverted, right? And so when I started and was telling people about what we do, the joke was calling all pro-life introverts, right? And there's always a group in anywhere I speak that come up at the end and they're like, I've always felt really awkward doing the activism stuff, but this sounds fascinating to me. And if you're listening and you're doing that, like, I know who you are, right? There's just like a certain kind of brain that goes, this is so interesting. And that's me. And I figured that part out and found my spot. But really it's people who maybe don't want to be out and in the middle of things and maybe have some anxiety talking to people or engaging in those ways. But there are things that we can do right here at home on our computer. The caveat is, I will say, is please do not do anything illegal. We get all of our information completely legally. Using open records or firsthand testimonies. We actually won't even take information if there are questions about how it was obtained. As a policy on our end, like, if you got it illegally, we don't want it. And we don't need to, because the abortion industry is so careless that they make it easy for us to get this information. But we use a lot of just open records requests and talking to the community members. Like, if you want to know what's going on at the abortion facility, you just ask the pregnancy center. I mean, they're going to know, because they are talking to women day in and day out who've been into those facilities. The sidewalk advocates, they're standing out front. They see we have just crazy stories about girls coming out bleeding and trying to drive away in a car still woozy from anesthesia, like just absurd things. And so anything that you witness, obviously you want to report, but you can start looking at open records and looking what your state makes available as far as the health department and the medical boards, and, ask for licenses, ask for inspection reports, and just start reading and looking for discrepancies. I mean, that's a big part of what we do, is just digging through thousands of pages of documents, looking for those discrepancies, looking for those loopholes, looking for those mistakes. The Planned Parenthoods we shut down in upstate New York, it was like construction permitting issues and like zoning, because they had lied on their certificate. I'm going to get in the weeds, but if you know what a certificate of need is, they lied on it. They submitted it with the wrong county. I mean, it just, everything about it is like, if Planned Parenthood is talking, they're lying. They couldn't even fill out this paperwork correctly. And so we had pulled all our construction permits and things like that. Like, all of that is open record. And so we just start asking the agencies in the area for information. We start reading through it and we start talking to the people involved, and can usually build a pretty good case. But yeah, I mean, the other thing I'll say is, when we are submitting these requests and things, even when we submit complaints, like, we aren't using pro-life language. Our name, Center for Client Safety, is very benign. Like, it's very neutral, because we don't want them to be defensive immediately. And so we actually work to build relationships, and we're really kind to these record keepers, because we want them to be our friend. And the agencies that we work with, we want them to be motivated to act on our complaints. And so we work to just build really good relationships with them and speak kindly to them. And when we submit our requests and things like that, we do it in a nature that makes their job super easy, and we're understanding. And that, honestly, that is probably what makes or breaks a lot of our success is when people go in and they're just defensive immediately, or they don't submit things correctly. The agencies don't want to work with you. I mean, you're making their jobs harder. And so a huge part is like, let's build those relationships. Let's see how we can help them. And that's like, if I've met somebody and I found out that they were like a health inspector, I'd be like, you're my new best friend. Like, let's be friends. And I think that's a big part of it too, is build relationships with these people and be kind.
Mm-hmm. All right. When we get back, we're going to talk with Missy about not just focusing on the individual abortion killing centers, but what happens when state law is not being enforced statewide. We have a situation like that seems quite clear here in Florida. We'll ask her about that. But also following up on what she was saying, again, I totally agree and love what she's saying about discerning your gifts and answering God's call, specifically at where is he calling you to be active in pro-life work. So it all begins with prayer. But I will say, as one who is more introverted and has been called into the more extroverted side, that is a possibility as well. I've spent a lot of time on the sidewalk, and as co-founder of the Men's March, the Lord has pulled me into some uncomfortable places. But so we got to be open to all things. But we're going to be back. Stay tuned. Welcome back to The Simple Truth. Jim Havens here with Missy Martinez-Stone, President and CEO of the Center for Client Safety, centerforclientsafety.org. And where we left off, so yeah, we've been talking a lot about, how to shut down individual abortion killing centers, which extremely important. And then there's also this side of it, though, like an example right now we see in the state of Florida, where we have a state law on the books, an abortion law on the books that's been in effect since May 1st of last year, the Heartbeat Act that was signed into law and then again went into effect May 1st. And what we've seen here is that, even though it's a 6-week limit in terms of the law with exceptions, but mostly generally a 6-week limit, we're not seeing the numbers come down substantially in the way that they would if that law is being enforced, just based on the numbers that have already been reported. Plus, it seems that would make sense because by everything that we can tell in investigating this a bit and thinking it through, the enforcement mechanism for this state law seems to be the relying upon the abortionist themselves, relying upon the abortionist to be honest about gestational age. So it seems like that would be something that could be fixed by the DeSantis administration here in Florida fairly easy by adjusting what the enforcement mechanism would be, making a change to something like just saying, hey, there's already a 24-hour waiting period here in Florida where you have to have a mandatory ultrasound 24 hours before that abortion appointment. Why not just say that appointment has to be with a non-abortion doctor ultrasound? They're the ones that will give gestational age and sign off, and that documentation has to be in hand by the abortionist if they're going to perform, if they're going to do that killing, if they're going to do that abortion. Sadly, we even have to talk about all this, but this is where we're at. And so, Missy, just your thoughts on this in terms of when a state doesn't seem to be enforcing the law, and if you guys have ever taken on anything larger in scope like a state law like that.
So you are hitting the nail on the head of basically what keeps me the busiest these days, is because when we started, yes, the focus was enforcing the rules on the books and shutting down abortion facilities. What we didn't anticipate was the downstream impact, is that we would see how all the rules were either badly written or vaguely written in a way that they were not enforceable, or they just didn't even have an enforcement mechanism. And I'm going to give you a perfect example of this from Florida. The facility that we shut down in Pensacola, Florida, what we kept bringing to the health department was their lack of emergency protocols. And we said, like, this is dangerous. They do not have the appropriate emergency protocols in place. They were doing abortions, upwards of past 20 weeks. Their abortionists had no OBGYN training and no surgical training. I mean, it was an emergency waiting to happen. He sent 3 women to the hospital almost dead. How nobody died is a miracle that we know of. I mean, somebody might have, but it was atrocious. And Florida required that abortion facilities have transfer agreements or admitting privileges with local hospitals. So they said you can either have a transfer agreement, which would, in the situation of an emergency, there was an agreement between this abortion facility and a local hospital that they would be transferred there. They would have access to the medical records. They would have communications with people involved so that they could have that continuity of care. That woman could get the help that they need immediately, right? It makes sense. And every ambulatory surgical center has to have a transfer agreement. If you're doing surgery, you need to have a transfer agreement. And so they applied that same principle to the abortion facilities. And if you couldn't get a transfer agreement, you can at least get admitting privileges. So that means that the doctor themselves can come to this hospital and treat. So you can follow the patient. And again, it all has to do with that continuity of care, getting that woman the care that she needs in an emergency situation. Florida required these things, but they did not require any type of documentation, any kind of proof that these agreements exist. And so what we were finding was abortion facilities were just checking the box on their license saying, yeah, we have those. And then we would go to the hospitals and go, do you have a transfer agreement with this abortion facility? And they would say, no. And then we'd take it back to the health department and say, they don't have a transfer agreement. And then they would just change it, be like, oh, never mind, it's this hospital. Then we go to that hospital and be, do you have a transfer agreement? And they said, no. And so there was no way to actually look at the validity of these agreements. So they were just lying on their licenses and nobody was checking. And so what happened was we started seeing all of the loopholes and all of the ways that the abortion industry just takes advantage. If there is a technicality that they can figure out, they're going to take it. And I explained it to somebody this way. People that are writing medical code don't think that they have to say certain things. Like they don't think you have to say, you need to treat a patient privately in a room one at a time, right? Because that's just common sense. So it's not said. But what the abortion facilities are doing now is they're putting 10 plus girls in a room all together and they're handing out the abortion pill simultaneously. Technically, I don't know if that's illegal. I mean, you have to make the case of a HIPAA violation, but you tell any traditional physician that and they would go, what? Like that is obviously unethical, but it doesn't technically say that. And so what's happened is legislators are now coming to us and saying, how do we write better code? How do we write enforceable code? Can you make sure our code is enforceable? Can you help us get rid of these loopholes and this vague language? And so we just did this in Wyoming. So we just shut down a facility in Wyoming for this exact reason. The code, this abortion facility opened on a technicality. They got in on a loophole because the code was not written correctly. We informed the legislators and they went, we need to close that gap. And we were like, yes, you do. And they did. And the facility shut down. And so it's been really interesting because when we started, I didn't anticipate that we would end up being so actively involved in the policy end of it. But what's happened is we are now experts on that enforcement mechanism, and people are coming to us constantly going, how do we write better code? How do we write more enforceable code? What do we need to be putting in these rules? And I'm always saying, if you're going to write a code, you have to say, well, then how do you know? Well, how do you know? If you're going to require something, how do you know? How do you know that they did it? Because we can't, you nailed it. We are asking these abortionists to self-report, right? That's not going to work out for anybody. I mean, when we first started, I knew that children as young as 12 or 13 were going to the abortion facility here in Louisville. And I reached out to our local Child Protective Services and I said, how do you know that these cases were reported to Child Protective Services? And in good faith, the lady responded and said, well, they're mandatory reporters. And I said, and? She said, well, they're mandatory reporters. And I said, and? There was no check to that system. And therefore, they're assuming that these abortionists are of, upstanding morals. And they are not. A lot of them are not. Right. And so we have had to really have hard conversations, not only with state leadership, but now we're getting pulled into, we're working with Americans United for Life, who write model legislation federally and in states are like, okay, how do we take this principle and saturate, our own bills with it? Because it was just a blind spot for so many people. And to be fair, I don't think that the legislators had bad intentions. It's just, they just didn't know. They're just assuming that people are going to be of good character. And unfortunately, the abortionists that we are investigating, like I said, one has a history of Medicaid fraud. We have drug history. We have so many medical malpractice lawsuits. One of them was investigated for child sex abuse, was charged with criminal child abuse. I mean, these are not people that are interested in following administrative code. And, a big part of that is there's a saying, like, you can't practice vice virtuously. If these people are going to be willing to kill the most innocent, and harm these women, they're going to be okay with bending, administrative rules. And so, it's turned into a really interesting part of our work, is looking at how these rules are being enforced and fixing those gaps.
Yeah, and I think what the difficulty is going forward here as well is we're trying to raise awareness as we have discovered all of this, and we're trying to say, hey, let's everybody look at this. Can everybody see what we're seeing here? Clearly, this law is not being enforced in Florida, and this is terrible. It needs to be fixed. And so now we continue to try to beat that drum and raise awareness. And what we're finding is, sadly, the folks that we're contacting in the state administration, the DeSantis administration, are showing no interest in what we're bringing to their attention. In fact, it almost seems like they'd rather not know about it, which is which is very sad. Yeah, we appreciate that. And so
I'll make some calls.
Yeah, I reach out. I mean, I just did the little bit I could, try to reach out to the Florida Attorney General's office and just say, hey, what's the enforcement mechanism here? And after a month,
they're not going to be helpful.
Yeah,
they're not going to be helpful.
All right, you know what to do. We'll give it to you.
Yeah. Listen. I'll give DeSantis some credit. The last time we brought enforcement issues to him, they responded. And like I said, this was before we were on, but we've worked very closely with their office and, have advised them on enforcement issues. And we identified a lot of these accountability gaps, like the one that I mentioned about transfer agreements. And for a while, we had a very good working relationship. Now there's been some turnover. We've had to rebuild some of that, but this, unfortunately, what we see is behind the curtain, right? And so there's a lot of, I'm not going to, but I could name a lot of quote unquote pro-life Republican governors who behind the curtain do not act out on that value, and used it to get the vote. But then when they're actually in a position where they have that authority to do something, they are not helpful. And that's become a big part of the conversations we're having now, is we let people know, for the organizations that do endorsements and things like that, we tell them, because they want to know. They want to know, are they actually helpful? I mean, the Wyoming governor vetoed legislation last year that would have shut the abortion facility down. This is a Republican governor in Wyoming. He vetoed just basic licensure. And then, so they did it again. The legislators were so upset because it was common sense. So they did it again this year. He reluctantly signed it, but then he vetoed an ultrasound bill. And because they were trying to require, just like you were saying, 24 hours and an ultrasound, and he vetoed it. Thankfully, they had a super majority that overrode it. But, unfortunately, like I said, we see who is really going to put their pro-life values to work. And I'll give DeSantis credit. He has in the past. So we just need to have a conversation with him again.
Okay. Yeah. Anything you can do, greatly appreciated. Again, we're talking with Missy Martinez-Stone, President and CEO of the Center for Client Safety, centerforclientsafety.org. And you really do get an appreciation for the work that you and your team do as you do try to call around and navigate the bureaucracy and get passed on from agency to agency and person to person. And, they say, oh, I'm I'll transfer you over, and then they just hang up on you and things like that, So it's
people wonder why these cases take so long. I'm like, have you ever tried to get something done with the government?
Right, yeah. And just so folks are aware here in Florida, what we are talking about in terms of the enforcement of the 6-week abortion ban, these are the penalties that are in place, the criminal penalties for providers who perform abortions in violation. Third-degree felony charges, punishable up to 5 years in prison, fines up to $5,000. If the abortion results in the death of the woman, the penalty can be more severe. There are licensing penalties, losing medical licenses. There are civil penalties. The law allows for civil penalties, potential lawsuits against providers who perform illegal abortions, and various other things here that are involved. So there are some penalties. If we could get some enforcement, we're going to be back with Missy.
Yep.
Welcome back to The Simple Truth. Jim Havens here with Missy Martinez-Stone, our guest today, President and CEO of the Center for Client Safety, centerforclientsafety.org. Final segment here. And just one last question following up on Florida. And this is kind of an example, I think, that maybe you could just speak to the difficulty, I guess, of getting the kind of evidence that is needed to get some movement. I know you're familiar somewhat with this case. This is a local sidewalk advocate, a good sidewalk advocate down here in my neck of the woods of Fort Myers. And so he has discovered these documents from the Agency for Healthcare Administration here in Florida, which were completed July 8th, 2024. And they're showing well after the 6-week abortion law would have gone into place here in Florida, May 1st of last year. And it says an unannounced complaint survey for complaint was conducted and the complaint was substantiated. The following is a description of the deficiencies, and it says termination after the gestational age of 15 weeks. And it's saying this is only allowed, and it gives the conditions. You have to have 2 physicians certifying in writing that medical judgment that necessary to save the woman's life, or a physician certifying in writing that there's a medical necessity, some emergency medical procedure is needed, or also 2 physicians certifying in writing about a fatal abnormality. These are the conditions as part of this 6-week limit law here in Florida. And it goes on to conclude that for all 12 of these patients that they found documentation of here, the Agency for Healthcare Administration, it says that the center failed to provide evidence for these 12 patients of record, and that all their estimated gestational dates were 15 weeks or more. And they all say, they go through each of them, and it says no documentation of medical necessity was found. So, I mean, to me, a layman kind of reading through this, it's like, this seems like a smoking gun to me. But share with us, what are we looking at here? And is it really a smoking gun, or how are we to think about this?
Yeah. Well, there's a couple of things. We figured out very early on that the type of information that we need that would actually push a case forward was the standard's very high. And that's for a number of reasons. But one, the main reason was, if we go to these agencies and we're going to ask them to do something and want them to work with us, then we need to make sure that we are doing everything we can to not make their jobs harder, not ask unreasonable things of them. And so our own standard, even though we're not taking anybody to court, if we're going to take information to an agency, our standard is it would have to hold up in court. Like, it would have to be something that we have, primary verification of. And so we have a very, very strict, scrutiny of the information. But what we figured out was a lot of the sidewalk advocates in the pregnancy centers, they don't know what to look for, how to document it, or what to do with it, and get it to us in a way that raises that standard of our ability to submit them. So we actually developed an entire training. I was talking with Jarrell Godsey at Heartbeat, who's become just a dear friend. Him and Lauren Musica, the president of Sidewalk Advocates for Life, which is she's probably my best friend in the whole movement. We talk all the time, but they both said, can you develop a training for us to give our affiliates so they know what to look for, how to document it, and when to give you information. And so we have a training called the Client Safety Advocates Training, and that walks them through this whole process. What to look for, how to document it in a way that keeps you safe, keeps the victim safe, to make sure that it's valid, and getting it to us in a way that is legal. And so we actually developed a whole training just for that piece that a lot of the sidewalk advocates and pregnancy centers have done. But it's only a drop in the bucket right now. We need to do a lot more. But what you're looking at is just a classic example of a law going into effect and the agencies just having no idea what to do with it, right? And we've had to do this a few times where we've had to educate the agencies themselves on the enforcement, on the penalties, on their jurisdiction. Without seeing the documents myself, my guess is that either they are calling, since they went and they did the inspection, and they've asked for a plan of correction. The health department likes to close it after that, right? They like to go like, okay, we did our job. But there's no follow through to make sure their plan of correction was actually implemented. And so my guess is that there was some we did our inspection, we asked them for a plan of correction, we slapped their hands, slapped their hands and said, please correct this, and they're going to try to call it case closed. That's worst case scenario. Best case scenario is that this is one piece of an investigation that's ongoing, because if they've submitted this paperwork, if there is a case that's been opened, if they are investigating further, if the medical boards are involved, that's all confidential. So we wouldn't even know if that was happening. So there is a scenario in which there is something happening behind the scenes and we just don't know it right now. But I definitely want to follow up and see, okay, health department, you got this information. What did you do with it? And we spend a lot of our time reminding agencies how to do their jobs. And just saying, no, that's your job. No, that is your job. No, kindly, but hey, no, that's your job. And ACA, the Agency of Healthcare Administration, known as ACA in Florida, is notorious for trying to skirt their responsibility and pass it off to another agency or whatever. But, we have to just stay on them and go, no. You need to see this all the way. You need to see this all the way through. You identified these violations. Here are the penalties. What did you do? And look for proof of that.
Yes. Yeah. Please do look at it, because the conclusion seems like maybe the most scandalous part of all of it, which is it says that, basically, it says there was an inspection at a center, discussions went forward, and the centers were told to stop the 15.6, and that 15 was the cutoff, which is completely wrong. It's 6 weeks would be the cutoff, not 15 being the cutoff. So it seems like they're not even aware of what the actual state law is. So, please, if there's anything you can do. Yeah.
That's happened, honestly, and that just again speaks to bureaucracy is not efficient. There's been so many times where a law has gone into place and the people that are in charge of the enforcement are just never educated on the bill or their piece on it. And so we've actually gone into situations and we try to approach each situation assuming the best. We're just going to assume that you don't know. I don't want to assume hostility or anything like that until they show it, right? Because there's been a lot of cases where we've come in and we've said, hey, no, this is actually your job. And we explain the new code and they go, oh, okay. But unfortunately, the legislators sometimes pass these bills and then they don't tell the enforcement agency what their job is. And so sometimes it's just a lack of communication, but that's why we're so important, because we fill all of the, we've had a lot of cases where agencies in different states don't talk to each other. So if a doctor has a case in one state, we have to make sure that the other state that they're licensed in is told, because there's no guarantee that the state will tell them. And so there's just a lot of breakdowns in communication. And thankfully, Christine, our director, our chief investigations officer, is so good at filling all those holes, connecting all those dots, and following up and making sure these agencies do their job.
Mm-hmm. All right. Well, Missy Martinez-Stone, thank you so much for being with us today. And you certainly do seem like you have a gift for this, great skill in this. And so we're glad you're on these cases. Again, President and CEO of the Center for Client Safety, centerforclientsafety.org. Any final word that you'd like to leave us with today?
Yeah, being new, being innovative, doing something that no one else is doing. We need your support. There's been a lot of organizations that have been around for a long time, and that's amazing. But we're new and we're young, and we need people to come alongside us if we want to move this forward.
All right, help them out. Centerforclientsafety.org. God bless you all.